of the show, our three questions that
with Sugar Fix in Chicago with Dr. Jessica Emery. So thank you so much for jumping on.
I mean, I'm still going to work on it, but
yeah. Then right away, as soon as that first thing comes out, they sign up for it.
Hello and welcome to Dental Tech Chat. I'm your host, Allie, and today I have the pleasure to introduce you to Dr. Diane Romaine, and she has practiced general dentistry in Frostburg, Maryland since she received her DMD from the University of Pittsburgh School of Dental Medicine in 1995. I want to introduce you to our audience since you are such an incredible influence on the dental community, and you're bringing such great knowledge to our audience today, and you're such an inspirational figure, and I'm so glad to have you here on Dental Tech Chat. So welcome, Dr. Romaine.
Thank you, Allie. I'm really happy to be here with you today.
Yeah, I really have seen a lot of your work and you are just blowing me away. I saw everything you've done and you're just so kind and you just give back to this community. And it's just been so wonderful to see the organizations you've been a part of. And I just wanted to applaud you on all of your hard work because it definitely does not go without recognition. I mean, you can just see all of your accomplishments and you're truly a strong leader.
Thank you. I appreciate that. I never expected to be a dentist in rural Western Maryland, but life has given me the opportunity, and it's been a real blessing. So I'm really happy to talk to you today.
Yeah, and I just really want to start off right there where you already said how you didn't really know you were going to land into the dental community, and I just really wanted to know where like your passion drove from and how you got started in this field, and kind of share with us where everything kind of got started and where you're at now.
Sure. Well, I grew up in Pittsburgh, and my dad, who is 82 currently and still a practicing dentist, was definitely my big influence in becoming a dentist. From the time I was a little girl, I was always into doing things with my hands and loved to sew. So that was kind of in me. And I was just interested in a lot of things. I liked science, but I liked art, and I liked visiting with people and making things. So I remember coming across this quote by Dr. Jerry Groper, where he said, you know, a dentist must have the eye of an artist and the hands of a surgeon, the insight of a therapist, the tact of a diplomat, the reason of a scientist, and now almost of an epidemiologist today in the time of COVID. The skills of a business person and the experience of a dental tech, which comes in handy too. So, so, you know, I was a history and art history major in college. And after I graduated, you know, started working in restaurants. And I wasn't really sure. I knew my dad always wanted to be a dentist, but one day I just had this kind of cathartic thing of, hey, I don't want to just eat at restaurants and serve at restaurants. I'm going to go to restaurants. Yeah. So I said, okay, I'm going to go to dental school. I'm going to do this. And I think my life experience and working really helped me to prepare for what dentistry really is, that interaction with people.
Yeah, I agree with you. And how dentists, you guys just wear so many hats. Yeah. It's just phenomenal, like how you guys just do it all, and you guys don't even like, there's not even a thought about it. It's just like business management, communication, customer service, and like you said, just really going above and beyond and like being there and being so personable. I mean, you deal with people on a regular basis and you're helping them with their, you know, oral health, links right to your health. So it's just so great that you can educate them on if you're taking care of your mouth, you're taking care of your body. And overall, it's just so great that, you know, for what you've done and so much money raised to help those in need that can't, you know, get the basics and the essentials. And just really wanted to amend you on that, because I know it's definitely probably not easy, but you've definitely been putting that work in to get that help for people who don't always get it in other areas.
Yeah, I'm the president of the Maryland State Dental Association Foundation.
Yes.
Yeah, and you know, the support of Sodium Dental has been so integral to our work. But really, the foundation has rolled out Mission of Mercy programs across Maryland since 2010, whenever we started the Mission of Mercy, the first one in Maryland then, with a lot of help from our colleagues in the state of Virginia, right? So that kind of grew from there. And since our inception, I think we've put out about $23 million worth of free dental care in the state. And that's been a big policy influence too, because those programs don't go unnoticed, right? Different decision makers and political figures will come and see the need, and then that will kind of incite change. So that's been really super to see that from our Missions of Mercy. We've had some new legislation passed in Maryland for the advent of a dual eligible dental benefit, and for just a lot of things to support access to care for the folks that need it most in Maryland.
Yeah, and I think that is just so kind that you have done that and then placed it. And like you said, that it got just so much, building upon each other, and you're advancing that, and really growing the community. And just what you guys do over at Missions of Mercy is just so unbelievable. And you guys are just so above and beyond and helping the community out. And I just think it's so sweet that you're able to do this and also educate more of us on how we can help. And dentists can really get in there and also be helping out and getting their hands into this. So I think it's just really great to hear that you guys have been able to get so much momentum and helping integrate this into the community of the dental field. Because I think, having this organization has been so big, and having us be a part of it, we've been so great to be a part of the game changer that you guys have created.
Yeah, no, and it's interesting to see how much more efficiently we can work with technology in the environment of a Mission of Mercy.
Yes.
When some dentists come in and it's their first time working with, a sensor or some kind of piece of equipment, it's a great place for collegiality among students and dentists to learn new things and to make a common goal of helping people. And, it's true that the people that we help, it's a game changer. It's the difference between, being able to get a job because you finally have the confidence to go out and interact and talk and smile. And, but it wasn't easy getting started. It was interesting. I have this memory of saying, announcing to my colleagues in Maryland, okay, we're going to start the first Mission of Mercy in Western Maryland. And at the time, I think Missions of Mercy were, a bit newer, and some people felt them to be, kind of pushing the limit there, how's infection control, how's the flow going to be? And I have this memory of getting a call from the state dental director and the state epidemiologist. This is back in 2010, and then asking a lot of questions about what we were doing. And it took the preparation and study to kind of roll out our plan, get the support of our health department head here in Allegheny County, Dr. Sue Raver at the time, and then have, those folks in Maryland kind of finally have the confidence to say, okay, let's give this a try. So I think that's an important part of leadership, which I know you said you wanted to talk about, is having that courage to be like, okay, I'm going to do something hard here. Am I ready? Do I have the knowledge? Do I have the lines of communication to support the project? And then, okay, be willing to step ahead and take the heat and make it go right, no matter what happens.
Yeah, and you just touched on a lot of points that I really think make a great leader. Hearing what needs to be done, taking that, first step of risk because you're not sure how it's going to go, and start implementing the proper policies and procedures to where it will roll out. And, you guys have just continually again and again have been growing to success. And I know it's probably not been easy, but trial and error. And same with anything when you start implementing it, understanding how it will work, and then see if the team can figure it out with you and then grow it. And that's just tremendously what I feel like you guys have been able to accomplish. And it's just been truly amazing.
Thanks. No, but we really appreciate that. I mean, I find so often in leadership, the key is coming to the realization that someone else isn't handling the problem, right? Because it's really easy.
That's number one.
Like, oh, well, that needs done. I'm going to talk about it. I'm going to, kind of maybe complain about it or read about it. But what am I going to do about it, right? And that's a whole nother level that I think at the MSDA Foundation, we've really tried to engage in.
Yes.
I guess, yeah. So for example, whenever you see Missions of Mercy and you see people lining up, and that's great, I'm glad we do that, and it makes you feel good.
Yeah.
But to be empathetic to that person and say, well, but what is that person's dental home for the rest of the year? Like, where are they going to go? Are they going to go to the emergency room, or where can they go? So I think what we're really trying to do at the foundation is to understand some of the data in Maryland that tells us about who these people are and what their needs are, and then try to study and then educate our colleagues throughout the state to show them that need, right? To show them how money can be saved if we give people a preventive dental benefit in their overall healthcare costs, right? That's one of the things that this pilot dual eligible program is looking at in Maryland. So one of our projects now with the foundation that we're doing is actually collaborating with our colleagues at the University of Maryland School of Public Health to study the pilot and follow these folks as they now are, since June of 2019, having a dental benefit and seeing how their overall health is improved.
That is great to hear. Like, I mean, as you're saying, like educating, you know, letting them know what they need, and then they're able to doing that has got to be so beneficial. I mean, I'm sure these are definitely taking off. I mean, at first, again, it's got to take someone to take the, you know, initiative to get this started. And I think that's awesome that you guys have been implementing this and getting that more like well-known and integrated, I'm hoping, with more dentists.
Yeah. You know, there's this great quote by Leonardo da Vinci called, you know, everything connects to everything else. And I just find that as I go on with my career more and more, and you know, get involved at practicing dentistry at a higher and higher level, and understanding and seeing examples in patients of that oral systemic health integration, like in people that I know and I meet every day, you know, who have issues, who are in the hospital, who have outcomes, good and bad. It really all connects. And I think as a leader, we have to take responsibility to do our part to make it better.
Yeah, and you know, all links in a chain, but it takes also those very special people who know, you know, okay, well, this works with this, and then continue the chain to where it flows. You don't want kinks or a missing piece. And that's why I think dentistry, as you're saying, it's like, you know, it's almost like a puzzle as well. Everyone plays a very important part. You know, each piece has to fit a certain way, or else it just, you know, a puzzle has to go a certain way, or else it doesn't work. And I think it's really what you guys have done too. You know, you've been taking certain pieces that are, I think, missing in the game, but you're just building upon it. And you're like making sure that it's going to get completed. So that's really awesome.
Thank you. Thank you.
Yes. So I would like to also jump into some of our technology questions. So this would lead me into our first one, which is our diamond in the rough. So this is going to be something you've used in your practice, or going to different practices that you help, and seeing what types of technology has been a really big advantage to them that maybe not all our dentists know about, or something you've used that you've really been enjoying.
So to me, whenever I have students come into the practice, I always say that my intraoral camera is as important as my drill, is as important as my dental piece.
Yes.
And so I just could not ever practice without that, because to have a patient understand and be motivated to accept treatment, they have to see it. I hate that feeling, which maybe some of my colleagues would have, where you know a patient needs something and you're trying to explain that to them, but they look at you like you're trying to sell them a bag of goods, you know, or something unessential. So what I love about the intraoral camera is, as soon as I put that in there, and I have a very methodic way of doing it, you know, starting with the buckle of number 1 to 2, and kind of coming across to the lingual to 16, and then down to 17 over. And I don't need to say anything else. I mean, the person is just like, oh my God, nobody ever took the time to do that. Thank you. And they want to get treatment now. The only barriers there are then financial. So I just think you can't practice without an intraoral camera. And it's cute to see many dentists don't, and students don't so much. And so it's cute to see when I first get the camera. It's a little bit awkward for them to be looking at the screen in front and do it. So to me, that's as important as drilling, and people really, really need to know that. I have a low-tech one too, which I don't know if you want me to share that or not. But,
sure do. Yeah, I love hearing all the different things you guys are implementing or using.
So, you know, I make a lot of dentures, and I love making dentures, because I feel like I probably have at any one time maybe like 5 or 6 dentures going. And I know a lot of people who practice in cities, maybe they're lucky if they make 5 or 6 dentures a year, right?
Mm-hmm.
So I need to be good at it and predictable at it. And so there is a technique called the Celara, Celera denture technique, which enables you to duplicate a denture and deliver that denture in 3 appointments. And it eliminates base plates. And I love, even if a denture needs to be enhanced, you know, having the lab have a copy of it, I think makes lab techs happy. And that's been a really great low-tech thing. It's essentially like a laying denture duplicator, souped up. But that is my tip for making great dentures. So check that out on YouTube, Celara Denture.
You heard it, guys, Celara Denture. You got to check it out on YouTube, because this is going to definitely be interesting, because actually this is the first time I'm hearing about actually this piece of technology. And you're saying, you know, I mean, I've heard small things about how the dentures are working, but that's really neat.
No, and
a copy.
I have to tell you, you know, it was a lab technician in rural West Virginia that told me about that. And, you know, a lot of people are going to be like, oh, lab tech in rural West Virginia, you know, I want to go to a fancy lab. But I'll tell you, like, the realness of this woman who told me about this denture technique has just like helped so many people. And it is, I teach it all the time to students who come in and dentists who come in to observe.
Oh, yeah.
And I just find there's nothing like putting a try-in denture in a person's mouth and them saying, well, this feels great. You know,
that is good.
And dentists will know that that rarely happens. So I have this memory of making my grandmother's denture in dental school, and she hated it. She's like, this doesn't feel right. And I remember my dad putting her denture, old one, and the one I made next to each other. And I was like, oh my God, it looks nothing like it. Like, I never did that, really. Yeah. And so it was so funny. And so I always think about my grandmother's denture and, you know, trying to not overwhelm people with getting something so foreign to them to get used to, but rather just making better kind of what they have. And that's why I love that technique.
Yeah, if it's something that's already working, like you're saying, right? You just kind of want to maybe duplicate that in the best manner, that it's still comfortable and looks the same way. I mean, that's obviously where we're going. That's the goal.
Yeah. Well, I think too, it's a good lesson in really listening to your patients, because patients know what's going on with them and what they need and want. And I feel like sometimes we could just, you know, cowboy in there and be like, well, you gotta do it this way, you gotta do it this way. And we aren't listening. And so it's a good point of humility and listening to our patients. And even though like some of the dentures I get, I'm just like, oh my God, this denture is older than me. I'm 53 years old. And it has holes.
I bet.
Yeah, no, but these people are still using it. And so like something has to be, we got to listen to that and utilize some of that in our process going forward, I think.
I agree with you. I think listening and making them feel comfortable enough to also express like what's going on and how they're feeling. Because like you said, sometimes you just cowboy in, maybe they kind of like get a little nervous and they don't want to really express how that's actually maybe been bothering them, or they're, like you said, sometimes that money barrier also. So maybe getting them comfortable, hearing them out, and then they're definitely more acceptable to hearing your guys' advice, which is very beneficial also to the patient.
Yeah, definitely.
So yeah. And I couldn't also agree with you more on the intraoral camera. I think that's a wonderful point you brought up. And I really hope a lot more dentists can start implementing that tool, because it really does. I mean, that picture speaks 1,000 words. Can't go wrong with that piece of technology equipment. And it's just really, like, I think it needs to go hand in hand with your, like the drill, of course.
Absolutely.
And you know, if you put your x-ray images up with your intraoral camera pictures, it helps so much with understanding more than just that 2D image, because they look at an x-ray and they don't even know what you're looking at. But that intraoral camera image will show that dark spot of caries, and they're instantly like, what is going on, or a fracture in the tooth. So yeah, really great tool.
And of course too, that aids our business flow too.
It does, yes.
1,000 times, hey, send that picture along with the x-ray to the insurance company. But it really does help to get people payment on things that we know they need.
Oh yeah. Yes, that is definitely a big tip, because it just speaks for itself. You got to attach that image, because you can put a huge description, but nothing beats the picture.
Yeah.
No insane. Doubt. It's so awesome how advanced that can just make something go, oh, I get it. I understand.
Yes.
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 So I want to go into our number 2. It's our no risk, no reward. So this is a really fun question where this can be a piece of technology that you were going to get into, but then you didn't know if it was going to be advantage, but it actually turned out to be pretty great and it was worth the investment.
Yeah, so probably in about 2007, I started doing Arun Garg's implant continuum.
Mm-hmm.
And I remember back then sitting for my FAGD exam. And one of the questions on the FAGD exam is a CBCT, like required to do a dental implant? This is back in like 2007. Mm-hmm. And, I think the answer was, I don't know if it was yes or no. You know what I mean?
Yeah.
At the time it was debatable. And at the time back in 2007, a lot of these CBCTs, they were like $150,000.
Oh yeah, really expensive.
And I was just new into doing implants. But I soon found out that a CBCT is essential. It kind of to me is like a pilot flying without necessary instrumentation, right?
Yes.
So I went ahead probably about 10 years ago and invested in CBCT technology, and then in being able to do implants more predictably in the XNAP, which is a dynamic surgical guide for placing implants, and kind of interrelating that data that you get from the CBCT of the patient with your handpiece and your initial planned placement of the implant in your software. So to me, that has just upped my batting average of implant success.
Oh yeah.
And I feel like I am doing right by the patient to get that knowledge and take that responsibility to plan ahead of time. And, God bless my colleagues who are amazing surgeons who, have the experience to not use guided surgery. I mean, I think that is definitely with experience something that you may need to do less in some cases, but I really like using that and having that to back me up. So those 2 investments were definitely big. And at the time, it wasn't like I was doing, like it was a bit of a risk. What comes first, doing a lot of implants or that technology? And really, it kind of sometimes is that technology. Mm-hmm. Then you have the confidence to go in there and say, yes, I'm going to do your implant. It's going to work great. And we're going to do this. So that's a little bit of something to go into. And it's great to see how the price points on those things over the years have been coming to a level of more attainability. But I would just encourage dentists who want to start placing implants to really make sure they have CBCT. And if they're able, I love my XNAV as well.
Yeah, and that's such a wonderful tool to be using. It really advances and helps with understanding how to do the implant. And like you're saying, you get more accuracy, more confidence in how to do that procedure.
Yeah, I mean, it stinks to go in there and be surprised,
Yes.
And, and, in placing implants, it just, to me, I keep saying like flying, like you want your pilot to,
Oh, yes.
100%.
Know exactly what they're doing.
Let's do it.
Yes.
So we have so many things in dentistry that could get us, closer to that realm. I think it's up to us to gain the knowledge and invest to be able to do that for our patients. And I think we feel better and the patient's more assured, and it can be really a cool thing.
Yeah, I think it really is such a neat piece of technology, and it's really helped really with implants. I mean, it's the number 1 thing you should have it. Well, then I'm going to jump right into the flop. So the flop is going to be a very fun question. This one can be anything. It can be technology. It can be a piece of any type of material you bought in the dental field, and you thought it was going to be a great advantage of the practice, but unfortunately, it just didn't turn out to be exactly what you thought it would, hence being our flop.
So I probably like in the early 2000s, Hoya Kinbayo, right?
Mm-hmm.
Like the YAG laser. And
Yes.
I think I remember spending, I don't know, maybe it was like $45,000. It was a lot of money.
Oh, yeah.
But it was one of the first ones. And I remember I got kind of like, it was right whenever they released the second model, right?
Mhm.
So I got a good deal on the first one, and I was really hopeful this was going to enable me to, do fillings on people without anesthesia, and I found it to be slightly lacking.
Yes.
And I feel like it was because it was one of the early ones. And now I see my colleagues using dental lasers to do preparations and do so without anesthesia successfully in my kids and pediatric applications.
Mhm.
And that's something I'd like to kind of renew again. My journey there ended up moving toward technology for medicine and getting
Okay.
a diode laser, which I use a lot in doing periodontal kind of disinfection and a little bit of the Lynat procedure, right? Getting
Right.
that kind of 1060 wavelength.
Yes.
There are technology for medicine lasers that do that are diodes. So that was my journey there, but I do think I'd like to maybe revisit lasers today and how they're
Yes.
able to cut tooth. So I need to, that'll be one of my new tools.
Yeah, I think it's definitely something that's definitely becoming a new hot item in dentistry, especially with the technology piece of laser and using laser within your practice. I've had a lot of cosmetic dentists saying how wonderful that is, and they love it a lot. So, yeah, I think it's definitely been really great. And a lot of times, a lot of dentists right now have been telling me they've been doing a lot of CE to really figure out which piece is best for them to use. Because I said you can read a lot of the articles, but until you get it in your hand, you don't only know like all the features that it comes with, because every different type of laser is going to have different types of features.
Right.
So
Right.
they've really been explaining that to me, and I'm like, okay, that is really great to know for a lot of other dentists, because
Yes,
fingering in that field.
absolutely. And in some states, it's a tool that dental hygienists can use for disinfecting pockets. So
Yes.
in our practice, we will use that. And I find that my dental hygienists really have such affinity for that and really love it whenever they see the results of
Yes.
using that technology on their patients. I mean, they're so excited. And again, to the intraoral camera, they love to take,
Okay, yeah.
pictures and show the person, how much their bleeding's going down. And so it's always great to challenge staff when you can with
Yes.
mastering a piece of technology and having them be responsible for, the maintenance. And it takes a really smart staff member who's a total professional, be they hygienist, assistant, front desk, to really support dentists in keeping
Yes.
technologies that we use maintained and working well, right? So
Absolutely. Yeah. You want that efficiency piece, and
Yeah.
you want it to be moving within the practice, keeping the workflow steady and making sure that it's streamlined. So, there's no hiccups within a workflow of your day. And that's what's just so great about certain pieces. Like you said, but it takes a special person definitely within, your office, because they're going to also help train your other staff members on it.
Yes.
But having them understand it the best and how, to set it up, clean it, and then also use it with the patient and feel comfortable using it.
Yes. No, and I mean, it's funny, whenever I started, I talked about, all those things that dentists need to be, but really dental assistants, especially, they need to be computer technicians now and, have depths of knowledge that are way beyond, what some
things
folks
have changed.
Yeah.
It's not just basics anymore. You're not just checking somebody in. Yeah. It's got, and just sitting there and just handing someone over a tool or doing the suction, like you're just got to know just as much, almost as much as your hygienist. So two different things completely, but everyone in the whole entire office has to wear different hats for so many different reasons, and it all has to work together. So
Absolutely.
Yeah, but coming from the dentist, it takes a really good leader though, so they can feel confident enough into knowing what they can and can't handle with delegation. With technology, I feel that's number one, the key thing.
Right.
So,
No, I really think investing in the education of your staff is super important. Then people really want to stay with you and want to be challenged and grow. So that is ongoing. Like it never ends.
Yeah, you never can cap out. There's always more to learn.
Yeah, and everybody wins.
Yes.
The staff member wins for feeling like they're growing, and they can grow, right?
Yes, they can. Yeah.
in income and in what they're able to give back to patients. Patients grow, and we do as well as dentists. It's great to have a co-pilot with us there in the upper
Yes.
story that we are confident in.
Yeah, they're definitely, like your, right-hand person. They're your go-to, and you need to make sure things are going along the way. They're right there to answer your question or get you what you need. So it's really great. Like you're saying, I like your co-pilot metaphor. It's very nice.
Yeah.
Yeah.
Definitely.
I think a lot of dentists would agree with you for sure. So
Yeah.
this brings me to wanting to know what your favorite piece of technology is in your practice, or just a piece of technology that you've got to like use and even like a CE or training.
My favorite piece of technology. I would say now it's the OmniCam,
Okay.
and just really being able to scan crowns has changed my flow incredibly.
That's nice.
So, whenever it was probably about 5 or 6 years ago, my lab technician who I work with was actually like, hey, we need to get an OmniCam here. Like, we need to up our game. And I was kind of hesitant, and I'm like, okay, I got the impression thing down.
Right.
It's all good. And it was my lab tech, Derek Staggs, that really encouraged me and set up some CE and training. And we got
nice.
the camera into the office. And now I couldn't live without it. Like, I feel like my crowns are so much better than whenever
Gosh, that's got to be so nice for your patients as well.
Yeah,
In and out.
I just feel like that the quality of dentistry that we could do now using scanning technology has just really improved. And it's such a time saver. I mean,
Oh my gosh, yes.
I'm preaching to the choir here, I think, but literally, if I have to adjust the occlusion on a crown now that I get back,
Just
I
handle it.
really, I am cautioned that something is wrong, right?
Mhm.
It's not seated all the way or something's
Nope.
up, because it's so rare that happens. It's, could I put a percentage to it? Maybe it's like 5% or less. I mean, it's really hardly any. Whereas before, in the days of impressions, I just remember a little bit here, a little bit there,
Yeah.
get it down, and I'm like, oh my God, what were we doing? So it's just great to see that we can keep getting better. And especially, like, I've been a dentist now for 25 years, and it's always important to challenge yourself in places where you're a little bit uncomfortable and learn and gain knowledge and get better, because that is going to make you more engaged as a dentist, and it's just going to serve your patients as well. And it's kind of fun. It's kind of fun to learn new things and challenge yourself. And that would be what I would encourage everybody to do. Is you don't need to do the same old.
No.
Yeah. So
Growth is huge with technology. It really does. It really just advances you. And I think it's like you said, that challenge, and it makes you feel good about it. It makes your team feel good about it. They are excited to work where you're at because you're, implementing things that their patients, want to see in your practice, or they can come get certain things done that they maybe can't get done in another practice since you implemented a certain technology. So it's really just all goes hand in hand once again. And I just think it's just really cool that a lot of dentists, when they start implementing these really neat pieces of technology too, it just helps their patients be able to get more done what they come in and they're not getting sent somewhere else, which is major. And the growth is just number one with technology. And I think just it advances everything. It helps push you, and it just builds upon itself.
Yeah, no, I think what you just said about patients not wanting to be sent somewhere else is so important. And from the time, I don't know if you have any dental students that listen to your podcast, but from the time you're in dental school, like if I look back whenever I was in dental school, you could have never convinced me that I would be a dentist who probably, maybe I do like 3 or 4 implants a week.
Yeah.
And take out a lot of teeth and have these technologies. If you would have said in dental school that would have been me, I would have said, are you kidding me? Like, no way.
Crazy.
Yeah, but it's so important to really take advantage of the experiences that you have there in dental school. Like, I remember at the University of Pittsburgh where I went, they had an IV sedation continuum to dental students, and I didn't do it. And that's probably one of my biggest regrets, is not having the understanding of how that might fit into things later.
Mm-hmm.
So I think it's so important for dentists to train and to be able to deliver at the highest scope of their ability to practice competently. Whenever I see patients come in and maybe they've been to, dentists who kind of have their comfort zone in the basics.
Right.
The big picture isn't really seen. I mean, that's why I love the HED and that mastership program and the AGD and the fellowship, because it forces you to study things that you might not really like, but you really need to know about, because they all interconnect. And when someone is coming to you, that is their expectation, that you'll be able to pull that together. And I think uniquely as general dentists, we really can, because
right, yes.
I'll never forget, I have dear friends with our local oral surgeon. But one time we went out with a group of local dentists to one of the Zimmer continuums for implants. And his desire was to try and train the local dentists on how to do the prosthetics and impression. This was years ago. But, here our local oral surgeon was in the lab and he had to work with some of these things. And he was like, oh my God, I'm out here. I can't do this. I don't know how you do this part of things. So it was interesting, because it just made the point of how, as a general dentist, we really need to pull all the pieces together.
Yes.
And that's so important. I mean, where I work and practice, there are patients with great medical complexity and patients who have had all the dentistry their teeth can take, right?
Oh, I bet. Yep.
And still we have to know how to get them forward, to save the teeth we can, to think about their overall health and not be afraid to take out the teeth that are not doing them any more good, right?
Gotta
be
go.
able to confront that, but then to be able to do that surgery if they're medically complex. And without being able to do that, I don't think that we're really getting them as healthy as they deserve to be and need to be. As we were saying, and I have a couple examples of patients who I saw and took care of who were seniors. I remember this. With abscessed teeth, or teeth where I'm thinking in my heart, this tooth really needs to come out of there. And the person will say, well, it's not hurting, or it's not bothering me. And, some of these old endo teeth with a big periapical abscess, and you see that on the CBCT, right? And like I would have seen on a PA.
You'll see that.
And just anecdotally, I've had a couple experiences, and this week in particular, where one of these gentlemen here, he ended up in the hospital with a septicemia of unknown origin, was the term, right? So it's like, well, unknown origin. Well, I knew he was supposed to come in my office this week to have a big abscess tooth taken out, but his daughter called me and he passed away in the hospital of this septicemia.
Oh my gosh.
And I'll tell you, like that, and I'm not saying that was his tooth, but I'm saying, like, as dentists, we really have a responsibility to look at areas in people's mouth, especially when we are owners of CBCTs. We have a responsibility to really look at that whole CBCT and make sure we're informing our patients of areas that just don't look right, right? And
Absolutely.
So I want to really make that case to my colleagues, because when you're in the field long enough and you do the kind of research too that I'm doing in Maryland, as far as people going into emergency rooms and, outcomes with people who actually, die due to dental related infections, I just think we really need to do our part to make sure that doesn't happen.
I mean, I agree so much with you on all those points. It's just like you said, I mean, oral health links so much to our regular health. And if we have the technology and the means to tell your patients that there's something wrong, or explain to them that it's connected to a health issue, it's very important.
Yeah.
And you guys do your due diligence every day by really going into that and seeing those issues and then relaying it to your patient. So it's just such a wonderful key piece to have the technology to be able to help your patients. And like you said, give them the most benefit and going and making sure they know what's going on within their mouth.
Absolutely. I mean, in Maryland, we were all brought to our knees in 2007 over the death of Diamante Driver, a young 12-year-old boy who, as tragic as his death was, I feel like we really in Maryland tried our best to learn from that and move forward and really establish a sound children's dental Medicaid program. But it was interesting because as I've looked at statistics, and we looked at statistics across the state and getting our dual eligible Medicaid program together, one of the statistics that came out was between 2013 and 2016, 15 Maryland adults died entering Maryland emergency departments of a dental related infection. So I feel like we need to be aware and really see that and make sure we're diagnosing and helping these people. And whenever they try to talk us out of it because it's not hurting, kind of pushing back a little bit and saying, hey, you need to handle this and I'm going to help you do that.
Yeah, offering the hand and just kind of letting them know firsthand what you're seeing. Because at first there's putting it off because maybe it is uncomfortable for them to even talk about. But, giving them, again, that peace of mind and letting them know, hey, there is something wrong. And we got to let them know that it can be handled and you're here to help them. A lot of people are scared to go to dentists, and it's they're just so, you guys are key to make sure your health is okay.
Yeah, no, I think so many people are well, if it doesn't hurt, don't fix it. You know what I'm saying? But, and that, that we have to be careful of because we know more than that and we can see more than that in our technology and based on our experience. So we need to take the responsibility to guide patients to the right path for treatment. Hopefully most of the time be able to do that ourselves, delivering it from the dentist who has the relationship with them, who cares about them, who knows their family, and that we have a confidence to, even though they may be complex, to be able to see them through that procedure. And if we don't, to take the responsibility again to be okay, I'm going to call the oral surgeon for you. I'm going to call the endodontist for you. We're going to get this going, and not just leave them out there hanging as, well, I can't help
until
you.
it catches up.
Okay, go handle it yourself. I mean, that's not caring. We need to go that extra level.
And that's why I say dentistry is so unique because you really do get that. With anything with medical, but of course, just dental. It's the first thing. It's just such a unique bond with your patient too. You get to literally have a little more time with them. Sometimes, a lot of times if you're with the right doctor, of course they spend some time with you, but your dentist, getting your teeth looked at or getting a procedure done. It takes a little bit of steps to get to it. So you're seeing them more than once sometimes for bigger issues, of course, but right in one visit, they get to build that relationship immediately with you. And you said, and you'll be able to get that comfortability factor and helping them get the right process and the ball rolling instead of just being stagnant, like you said, and just, if it's not hurting, let's just, push that under the rug. I think it's great that you guys are always able to always give us the right encouragement and knowledge of what's going on. The service you guys give because you have the right tools to do so.
Right.
And it's just been so incredible to see how dentistry has been so evolving. Just like you said, you've been doing this for 25 years. I bet it's just been amazing just to see how much has grown and developed and just even these past 10 years, right? With just the digital world and this landscape of how you guys can connect and send images in a matter of minutes, showing your patients in a matter of, seconds, a digital image. It's just incredible to be able to give your patients these tools so they can be better educated on what's going on. It's just been so cool to hear what you guys are using every day and so your patients really benefit.
Absolutely. And, and from here on out, hopefully we could do that with our physician colleagues a little more, kind of interacting with them and sharing those records and those types of patient health histories and coordinating with them better for overall health. I had the honor of being involved in the ADA Elder Care Work Group, which was about a year and a half in the making, and was kind of providing a report and some policy recommendations to the ADA on a dental benefit Medicare and dental benefits to seniors. And, in that experience, you really see how, 2/3 of seniors really don't have a dental benefit.
No.
And again, too, like, so what does that mean in an experience in my office? So I have this memory of a local college kind of administrator from our local college, very intelligent person, bringing his elderly mother who had come to live with him to see me. And she was a denture wearer, and she opened her mouth and pulled out her denture because she had a denture sore. And oh my God, like, you just knew in your heart, right here,
Oh, goodness.
And you just knew it, and you would say to yourself, hey, these are intelligent people, these are educated people. And I said, well, why didn't you come sooner? And first of all, they said, well, she always went to her doctor, and her doctor said, oh, she's fine, it's okay. Which I really,
yeah,
sure. But then it was, hey, she doesn't have dental insurance, so we just really didn't come. And again, there too, some months later, she died of oral cancer. And so I just think it's just tragic whenever seniors who, should get the most respect in our society.
Yes.
I mean, in my family, I grew up and was raised with my grandmother living in our house in this very traditional Polish kind of household. And so seniors were somebody that you really, respected and cared about. And I feel like maybe that's something, as much as COVID, we are in the midst of it. I hope that as we come through it, maybe that will give us a sense of really elevating seniors and making sure they have really, really good care.
Yeah, I agree that I think they do need to be, again, like, brought more to a priority point on the stage. Cause you said, sometimes it's just, oh, they're not in pain or the dental insurance isn't there. And sometimes they just, can't even get out. So I think a lot of times too, I've been seeing some dentists who do the traveling and they're going to the homes and making sure they're getting the just essentials, which is so nice. But again, like you're saying, it's just the elders or seniors really do need to be brought to the forefront and making sure that they're getting the proper, checkups, because they're really probably falling on that back burner. And it's just so sad. Like you said, this, as we get older too, that oral health, you got to be watching it, because it's going to right away, the mouth is like, it heals itself quick, but a lot of times as we age, it's harder to get that healed. And if you're not watching it, it's going to definitely create some more links to more issues.
Yes.
Yeah. Well, I think you've touched on some really fantastic points for us today, and you've given us such wonderful advice, and I'm so glad to have you on today. And thank you so much for sharing with us all of your knowledge and everything you've been doing with Missions of Mercy and the foundation. You have done some incredible things, and I've been so grateful to have you here today and telling us all about how we can help do more in the community and be more influential in helping everybody.
Thank you, Allie. It was my pleasure. Yeah. Good luck to all the dentists out there. Yeah.
Yes. Thank you. It was so great to have Dr. Diane Romaine here on the Dental Tech Chat, as she explained to us some key aspects of what makes great leadership. And the first and foremost thing as a dentist, as she explained, is to listen to your patient's needs. Again, she went over some great features and advancements that she's added to her practice using dental technology, and how they help with her workflow at her practice and how they help with her patient education. Dr. Diane Romaine is truly such a special person who cares so much about the dental community. She brings all these traits of fearless leadership into her practice and the dental community as an influence to help those in need. Helping her patients at her practice, Dr. Diane D. Romaine and Associates, and as the president of the Maryland State Dental Association Foundation, she truly knows how to be a strong, fearless leader in helping influence the dental community and helping those all around in need. Make sure you visit her practice if you're in the area, and you connect with Dr. Diane Romaine on her Facebook and LinkedIn page. Thank you guys for watching our Dental Tech Chat and supporting us here on Spotify, YouTube, or wherever you listen to our podcast. I hope you guys have a great day, and if you have any dental technology questions or want to learn more about dental technology, please stay tuned on our Facebook and on YouTube. And thank you guys again for watching, and we hope you have a great rest of your day. Bye, guys.